This is the endocrine system beginning on page 216 with anatomy. Endocrine glands secrete, form, and give off hormones into the bloodstream. The hormones travel throughout the body, affecting organs, including other endocrine glands, and controlling their actions. Starting with our terminology, we have adreno, which means adrenal gland. Adrenopathy is disease of adrenal glands. Adrenalo also mean adrenal gland. Adrenalectomy is the removal or excision of adrenal glands. Hypophyseal means pituitary gland. Hypophyseal is pertaining to the pituitary gland. Oophorio means ovary. Oophorytis is inflammation of an ovary. Ovario is also ovary. An ovarian cyst is a sac containing fluid or semi-solid material in or on the ovary. Orcho means testes. Orchitis is inflammation of a testicle. Orchio also means testes or testicle. Orchiopexy, a surgical fixation of the testicle into its proper location within the scrotum. Orchido, again, also means testes or testicle. Orchidectomy is removal or excision of a testicle or testicles. Pancreato means pancreas. Pancreatectomy is removal of the pancreas. Parathyroido means the parathyroid gland. Hyperparathyroidism is higher than normal level of parathyroid hormone in the blood. Pituitaro means pituitary gland. Hypopituitarism is decrease or stoppage of hormonal secretion by the pituitary gland. Thyroid adeno is the thyroid gland. Thyroid adenitis, inflammation of the thyroid gland. And thyroido also means thyroid gland. Thyroidectomy is removal of the thyroid gland. Next section is pathology terms for the endocrine system. Acromegaly, enlargement of extremities caused by hypersecretion from the anterior portion of the pituitary gland after puberty. Cushing syndrome, group of clinical features produced by excess secretion of cortisol from the adrenal cortex. These signs and symptoms include obesity, moon-like facies, fullness of the face, hyperglycemia, and osteoporosis. Diabetes mellitus, disorder of the pancreas that causes an increase in blood glucose levels, or hyperglycemia. Type 1 diabetes, with onset usually in childhood, involves complete deficiency of insulin in the body. Type 2 diabetes, with onset usually in adulthood, involves some insulin deficiency and resistance of tissues to the action of insulin. Goiter is enlargement of the thyroid gland. And hyperthyroidism is overactivity of the thyroid gland, also called Graves' disease or exophthalmic goiter. This is when eyeballs bulge outward. Next are our laboratory tests and diagnostic procedures for the endocrine system. Exophthalmometry Epigrammometry is measurement of eyeball protrusion, or exophthalmos, as an indicator of Graves' disease, or hyperthyroidism. Fasting blood sugar, or glucose test, measurement of glucose levels in a blood sample taken from a fasting patient and in specimens taken 30 minutes, 1 hour, 2 hours, and 3 hours after the ingestion of 75 grams of glucose. Delayed return of blood glucose to normal levels indicates diabetes mellitus. Radioactive iodine uptake, measurement of how much of a radioactive element, iodine, is absorbed by the thyroid gland. The radioactive iodine is given by mouth and measured as evidence of thyroid function. Serum and urine tests, measurement of hormones, electrolytes such as sodium and potassium, and glucose levels in blood serum and urine as indicators of endocrine function. Thyroid function tests, measurement of levels of T4 thyroxine, T3 triiodithyroidinine, and TSH, thyroid stimulating hormone, in the bloodstream. And thyroid scan, procedure in which a radioactive compound injected intravenously localizes in the thyroid gland. A scanning device produces an image showing the presence of tumors or nodules in the gland. Next, our abbreviations for our endocrine system. A1C, hemoglobin A1C, or HbA1c, measures the average amount of glucose in red blood cells. Useful to follow control of glucose in diabetic patients. Hemoglobin is a protein in red blood cells that carries oxygen and links with glucose. ACTH, adrenocorticotropic hormone, and this is from the pituitary gland. DM is diabetes mellitus. GH is a growth hormone secreted by the pituitary gland. GTT, glucose tolerance test. This measures the ability to respond to a glucose load, and this is a test for diabetes mellitus. K plus is potassium, an electrolyte. Na plus is sodium, also an electrolyte. RAIU is radioactive iodine uptake, a test for thyroid function. T1D is type 1 diabetes, and T2D is type 2 diabetes. T3, triiodothyroidinine, a hormone from the thyroid gland, and also T4 is thyroxine, another hormone from the thyroid gland. And TSH, thyroid stimulating hormone from the pituitary gland.